From WNYT Albany, News Channel 13 live at 5 begins right now.
A new healthcare powerhouse in the capital region becomes official tonight. The merger between St. Peter's, Northeast Health, and Seton Health becomes official at midnight. All of the hospitals involved will retain their individual identities. However, they'll be known as St. Peter's Health Partners.
From WNYT Albany, News Channel 13, Weekend Today begins right now.
3 local hospitals are now partners in health. The merger between St. Peter's Hospital, Northeast Health, and Seton Health became official at midnight. All of the parties involved will retain their individual identities. However, they'll be known as St. Peter's Health Partners.
Live in high definition, the CW15 Morning News.
It's now a done deal. Your Jump on the Day's news continues with today's announcement that a major merger of local health providers has been completed. St. Peter's Health Operations is the new not-for-profit now in charge of what's being billed as the region's largest private employer, covering some 12,000 employees.
Live from WTEN. This is News 10 at 4 on the news station.
Closer to home, a monumental change to Capital Region healthcare today. 4 area hospitals uniting to form the area's biggest medical system. News 10's Christine O'Donnell live outside Albany's St. Peter's Hospital with what the change means for you. Christine?
Lydia, it's official. St. Peter's Health Partners is now the largest healthcare system in the capital region. Now, the leaders from the corporations involved met here earlier today. Now, under this partnership, 4 hospitals will now operate as one. Albany Memorial is one of those hospitals, St. Peter's Hospital, where I am now, St. Mary's in Troy, as well as Samaritan Hospital in Troy. Now, this new organization has more than 11,700 employees at more than 125 locations in northern New York. Officials here say this merger will create a more cost-efficient type of health care.
We now have this new entity, and we're here for really one purpose and only one purpose, and that's to better serve the community. And we decided a long time ago that we could better serve the community by working together rather than separately.
About 40,000 people use these hospitals every year, and some of the concerns here were whether their health insurance provider premiums would go up. And I did speak with the president of SPHP, which is the leading health insurance provider in the capital region, and he says that not right away they won't go up, but we're going to have to wait and find out as the years continue to go by. And we'll have more on that coming up later on. Live at St. Peter's, Christine O'Donnell, News 10.
Thank you, Chris.
This is YNN, your evening news now.
The long-awaited merger of several Capital Region hospitals is finally complete. Albany Memorial, St. Peter's, Samaritan, and St. Mary's hospitals are now part of St. Peter's Health Partners. Board members gathered for the announcement Monday. SPHP now becomes the largest nonprofit health network in the region, with an annual budget of more than $1 billion. The group is aimed at increasing quality, expertise, and access for patients while lowering operating costs.
The number one deficit of the health system in the United States is fragmentation. We hope to eliminate ultimately, but certainly diminish the fragmentation that patients and clients will experience in St. Peter's Health Partners.
We've known for some time that the reimbursement model for healthcare is broken. The fee-for-service approach to healthcare is not conducive to, in fact, cost efficiency, and we have been looking to change that model.
Sunnyview Rehabilitation in Schenectady, the Eddy, and the Community Hospice are also now part of SPHP. The merger officially took effect over the weekend.
From the 10 o'clock news team, Fox 23 News at 5 starts right now.
The merger to create the Capital Region's largest healthcare provider and its biggest private employer is now complete. St. Peter's Healthcare Partners, a joining of St. Peter's, Seton Health, and Northeast Health, became official on Saturday. Under the deal, each of the group's 4 hospitals will stay open in some way, with St. Peter's and Albany dealing with major specialized care. Officials say this is the result of the realization that the community was better served by them working together rather than apart.
From WNYT Albany, News Channel 13 live at 5 begins right now.
Today marks the first weekday of operations for St. Peter's Health Partners. It's the result of a merger that took 4 years to complete, incorporating St. Peter's, Seton Health, and Northeast Health. The new organization has more than 11,700 employees at more than 125 locations in 7 counties. The executive steering this unique marriage of healthcare cultures promise it'll streamline your healthcare services.
This is a very complex system that we put together with 3 different entities.
But the payoff of this 4-year project, says CEO Steve Boyle and the other players in this merger, greater access to and coordination of health care.
So by raising quality, we will also lower our costs.
Add that to the greater buying power of this group, which Boyle says should also lower costs. That savings, says Ann Sale, former CEO for Bellevue Women's Hospital and now a consultant with groups undergoing change, brings other benefits that improve care.
The benefits of this kind of merger are that we'll be able to attract physicians of a caliber that we can't attract right now because we don't have the resources to help them do their job and provide the equipment that they may need.
Rather than each hospital competing to have the newest equipment, the so-called medical arms race, now decisions to buy the newest medical technology will be based on the group's overall needs. Fully integrating St. Peter's, Seton, and Northeast Health will take years. But right from the start, there's Burdett Women's Health, which just opened. It's on the Samaritan Hospital campus in Troy and dedicated to women's health. It's a separate entity, so it bridges cultural differences between the secular Northeast Health and Catholic culture of St. Peter's and Seton.
And brings women's reproductive services to a new level in Troy, and we're very proud of that. We've already begun the consolidation of our home care divisions. Those divisions are being consolidated into the Eddy VNA.
And inpatient rehab services will be centered at Sunnyview in Schenectady. Changes at other facilities are still being evaluated. As this merger takes place, Albany Medical Center is in the midst of a $360 million expansion and renovation that should be completed in the summer of 2013. So is the Capital Region big enough for both organizations, and how will health insurers be affected by the merger? That part of the story, live at 6.
This is CBS 6 News, now in high definition.
It's the largest healthcare provider in the region with nearly 12,000 employees at more than 125 locations in 7 counties. The merger of Northeast Health, St. Peter's Healthcare Services, and Seton Health is now official and operational. It creates St. Peter's Health Partners, a new not-for-profit serving as the parent corporation for all 3 organizations, a process that's took nearly 4 years.
And we're here for really one purpose and only one purpose, and that's to better serve the community. And we decided a long time ago that we could better serve the community by working together rather than separately. And with that determination, we pressed on, and here we are.
The merger includes Albany Memorial Hospital and St. Peter's Hospital in Albany, Samaritan Hospital and St. Mary's in Troy, Sunnyview Rehab Hospital in Schenectady, as well as the Eddy system of continuing care and Community Hospice.
From WNYT, Albany, News Channel 13, live at 6, begins right now.
Healthcare and schools are 2 of the top reasons affecting why companies choose a community in which to set up shop and why people decide to put down roots. Well, today, healthcare in the Capital Region was formally reshaped as St. Peter's Health Partners is completing its first weekday in operation as the area's largest private employer.
We now have this new entity, and we're here for really one purpose and only one purpose, and that's to better serve the community.
Now that St. Peter's, Seton Health, and Northeast Health, and the 4 hospitals between them are under the banner of St. Peter's Health Partners, there are 4 goals, say the executives. Improve quality, access to care, streamline services by reducing the fragmentation of services, and trim overall cost of care.
With the ability with all the resources that we have and spreading out costs over overhead, we think we can also reduce costs as well.
They also see the merger as a way to change how services are billed, moving to something called bundled payments. Rather than each doctor sending a bill, the overall treatment is organized into one treatment plan and cost.
And that's the trend across the nation. So I'm really happy to see that that is happening here and that we're going to be thought leaders in implementing that.
Sale, formerly the CEO at Bellevue Women's Hospital and a consultant for companies undergoing change, also believes the merger will help the Capital Region recruit more top-of-the-line doctors, as money the hospitals used to spend competing with each other can go towards salaries and the latest technology.
We're already in discussions with various medical groups who'd like to use this new model in innovative ways for their own practices, and we stand ready to do that.
Well, Burdett Women's Health, a freestanding women's health care center, has now opened on the Samaritan Hospital campus in Troy. Other changes to the delivery of health care are still being evaluated. It'll take years before the full impact of this merger is felt.